I want you to do something right now. Swallow once, just once, and pay attention to what you feel at the back of your throat. Is there something there? A heaviness? A sticky coating? A thickness that never fully goes away no matter how many times you clear your throat, sip water, cough gently, or try to ignore it? Now let me ask you something even more important. How many times have you cleared your throat already today? 5 times? 10? 20? So many that you do not even notice it anymore? Because that is what happens with symptoms like this. They rarely arrive all at once. They creep in quietly. At first it is only in the morning. Then it shows up after meals. Then it lingers through the afternoon. And before you know it, it becomes part of your daily life. You carry water everywhere. You avoid certain foods. You keep lozenges nearby. You clear your throat before speaking. You wake up feeling as if something has been sitting there all night. And maybe the most frustrating part of all is this: nobody has ever explained to you clearly why it is happening. You may have been told to drink more water. You may have been told it is allergies. You may have been told it is just post-nasal drip. You may even have been told, well, that just happens as you get older. But here is what I need you to hear today. Persistent throat mucus is not random. Your body does not create symptoms for no reason. When something keeps showing up day after day, week after week, month after month, your body is trying to tell you something specific. The question is not whether there is a reason. The question is whether anyone has taken the time to connect the dots for you. And today, we are going to do exactly that. Because in my experience working in preventive health and senior wellness, persistent throat mucus is one of the most misunderstood symptoms I see in adults over 55. People treat the mucus. They treat the annoyance. They treat the throat clearing. But they never address the cause underneath it. And until you understand the cause, you end up living in a cycle of temporary relief and ongoing frustration. So in this video, I am going to walk you through 5 specific, research-supported reasons why persistent throat mucus becomes so common after 55. I am also going to explain the 2 causes that very often work together, making the problem worse than either one would on its own. And at the end, I am going to give you a clear, practical action plan so you know what you can start doing tonight, tomorrow morning, and over the next 2 weeks to begin changing what is happening in your body. My name is Dr. Franklin. I work in preventive health and senior wellness. And my promise to you is always the same: plain language, real science, and practical steps that make sense in everyday life. Before we go any further, I want you to tell me one thing in the comments. Is your throat mucus worse in the morning, or does it stay with you all day? Write morning or all day below. That one detail tells me a lot about what may be driving this in your body. Now let us begin with the one piece of biology that changes everything about how you understand this symptom. Your body makes mucus every single day, all night, non-stop. And that is not a problem. That is normal. In fact, it is healthy. Mucus is one of the body's protective tools. It coats the lining of your airways. It traps dust, allergens, viruses, bacteria, and tiny particles before they travel deeper into your lungs. It keeps the tissues of the nose, throat, and breathing passages moist, smooth, and protected. Without mucus, the inside of your throat would dry out, the tissues would become irritated, you would be far more vulnerable to infection and inflammation. So mucus itself is not the enemy. The real problem is what happens to mucus as we age. There is a system in your airways called mucociliary clearance. I know that sounds technical, but the idea is actually simple. Your airways are lined with millions of microscopic hair-like structures called cilia. These tiny structures beat in coordinated waves all day long, moving mucus upward and outward so it does not sit in one place and build up. When this system is working well, mucus gets produced, moved, and cleared so efficiently that you barely notice it. But as we get older, that system slows down. The cilia do not beat as quickly or as effectively. And when that happens, mucus that would once have been cleared in seconds can start lingering for much longer. That means any condition that causes even a modest increase in mucus can feel dramatically worse in an older adult than it would in a younger person. This is a very important point. Sometimes people think, I never had this problem before, so something must be terribly wrong. Not necessarily. Sometimes the issue is that your body is still doing what it has always done, but the clearance system is not keeping up the way it once did. That does not mean you should ignore it. It means you need to understand it properly. And with that foundation in place, let us go through the 5 most important causes. Cause number 1, silent reflux that reaches the throat. This is the one I want you to pay especially close attention to because it is one of the most commonly missed causes in adults over 55. Most people know what heartburn is. They think of acid reflux as burning in the chest after a spicy meal or a heavy dinner. But there is another form of reflux that often looks completely different. No chest burning. No obvious indigestion. No dramatic stomach symptoms. Just a throat that never feels clear. This condition is often called laryngopharyngeal reflux, or what many people simply call silent reflux. Here is what happens. There is a muscular valve between the esophagus and the stomach. Its job is to stay closed after you eat, so stomach contents stay where they belong. Over time, that valve can weaken. And when it does, small amounts of stomach acid and digestive material can travel upward, especially when you lie down, bend over, or sleep. Now here is the critical detail. Your throat and voice box are much more delicate than your stomach. They are not built to tolerate acid. So even a very small amount reaching the throat can trigger irritation. And when those tissues get irritated, your body responds the way it usually does when it wants to protect tissue. It makes more mucus. That mucus is not the problem. It is the body's attempt to shield the area from damage. And because this often happens at night, many people wake up every morning with the same exact experience. A thick throat, the need to clear it repeatedly, maybe a rough voice, maybe a cough, maybe a feeling that something is sitting there. And yet they never suspect reflux because they do not have heartburn. That is why it gets missed. If your throat is worst first thing in the morning, if you often have to clear it after lying down, if your voice sounds rough when you first wake up, or if your symptoms get worse after a late meal, silent reflux needs to be on your radar. And there is one more point here that matters. Many older adults take anti-inflammatory medications for pain, things like ibuprofen or naproxen. These medications can reduce the stomach's natural protective defenses and make reflux more likely or more irritating. So if you take them regularly and also deal with ongoing throat symptoms, that is a conversation worth having with your doctor. Cause number 2, post-nasal drip from low-grade sinus inflammation. When most people imagine sinus problems, they picture something dramatic. A pounding headache, a blocked nose, facial pressure, a full-blown sinus infection. But that is not always how sinus-related mucus behaves in older adults. Very often, it is much quieter than that. The nose may not feel terribly stuffed. There may be no major pain. You may breathe fairly normally. And yet the sinuses can still be mildly inflamed and steadily producing extra mucus that drains down the back of the throat all day long. That is post-nasal drip. And the frustrating part is that because it is subtle, people often misread it. They think it must be allergies. So they take antihistamines. And sometimes those medications dry things out a little. But dryness is not the same as healing. In fact, when mucus becomes thicker and stickier, it can feel even more uncomfortable. The real issue is usually not that there is simply too much fluid. The issue is that the sinus lining is inflamed and the mucus is not clearing properly. And remember what we talked about earlier, the natural clearance system slows down with age. So now you have 2 things happening at once. The sinuses are making more mucus, and the body is less efficient at moving it. That is why so many people feel that constant trickle, coating, or need to clear the throat without ever feeling truly congested. If your mucus is there all day, if you feel it running down the back of the throat, if you frequently have to swallow to move something down, or if your symptoms get worse in dry air, heated rooms, or dusty environments, post-nasal drip may be a major part of the picture. And later in the action plan, I will tell you one of the simplest and most effective ways to start addressing this at home. Cause number 3, a medication side effect that often gets missed. This is where a lot of people get surprised. Because when we think about throat mucus, we usually think about the throat, the nose, or maybe the stomach. We do not think about our blood pressure medicine. But sometimes we should. There is a group of medications called ACE inhibitors, These are commonly prescribed for blood pressure and heart protection. They are useful medications. They help many people. But they also have a well-recognized side effect in some users: persistent throat irritation, throat clearing, and a chronic dry or tickling cough that can feel like mucus is always present. This happens because these medications can allow certain compounds, especially bradykinin, to build up in the body. In sensitive people, that can irritate the throat and trigger the urge to clear it over and over again. Now here is why this gets missed so often. The symptom does not always begin right away. A person may start the medication, feel fine for weeks or even months, and only later notice that their throat has become more irritated. By then, the connection is not obvious. So they never think to mention the medicine. And their doctor may not immediately connect it either, unless the timeline is reviewed carefully. This is especially important in older adults, because medication side effects often show up in subtle ways. Not dramatic. Not dangerous at first. Just persistent. Annoying. Easy to dismiss. If you take medication for blood pressure, and your throat symptoms began sometime after starting it or changing the dose, bring that up specifically. Do not stop the medication on your own, but do ask whether it belongs to the ACE inhibitor family and whether there may be another option if it is contributing to the problem. Sometimes one overlooked medication detail changes the whole story. Cause number 4, chronic mild dehydration. Now let us talk about something that sounds simple, but matters much more than most people realize: hydration. And I do not mean this in the vague, unhelpful way people often say it. I mean the actual biology of what happens to mucus when the body does not have enough fluid. Mucus is largely made of water. Its texture depends heavily on hydration. When the body is well hydrated, mucus tends to stay thinner, more mobile, and easier for the cilia to move. When the body is mildly dehydrated, mucus becomes thicker, stickier, and harder to clear. That means it sits. It clings. It collects. It becomes something you feel. And here is where aging changes the picture again. As we get older, the sense of thirst becomes less reliable. You can be underhydrated and not feel especially thirsty. So if you are waiting until your body clearly tells you to drink, you may already be behind. That is why so many older adults live in a state of chronic mild dehydration without realizing it. Not enough to feel acutely ill, not enough to cause a dramatic problem, but enough to make the mucus in the throat thicker day after day. And once that happens, every other issue on this list becomes more uncomfortable. Post-nasal drip feels worse. Silent reflux feels worse. Medication-related irritation feels worse. Even normal morning mucus feels worse. So hydration may not be the only cause, but it is often the factor that amplifies everything else. And because it works in the background, people underestimate it. They say, "I drink some water." But the real question is not whether you drink water sometimes. The real question is whether your body is consistently receiving enough fluid throughout the day to keep mucus moving the way it should. That is a very different question. Cause number 5, the gut-airway connection. This final cause is the one that surprises people the most, because most people do not think of the gut when they think about throat mucus. But the body does not divide itself into separate departments the way we do. The gut talks to the immune system. The immune system talks to the airways. And when the gut is inflamed or out of balance, the throat and lungs can absolutely feel the consequences. There is a growing body of research around what is often called the gut-lung axis. Here is the simple version. The bacteria living in your intestines help regulate inflammation throughout the body. When that microbial balance is healthy, the immune system tends to stay more regulated. When that balance is disrupted by years of low-fiber eating, repeated antibiotics, high sugar intake, poor sleep, chronic stress, or a very limited diet, the immune system can become more reactive. And one of the places that reactivity may show up is in the airways. That can mean more inflammation, more sensitivity, more mucus production. Not because there is a primary infection in the throat, but because the body's inflammatory signaling has shifted. This matters especially in older adults because over time, many people accumulate factors that strain the gut microbiome. Antibiotics here and there, more processed foods, less fiber, less variety, more medications, more stress. So even though the symptom shows up in the throat, the deeper driver may be part of a bigger inflammatory pattern. This is not the first place I would look in every case. But when symptoms are persistent, especially when they occur alongside digestive bloating, irregular bowel habits, food sensitivity, or a long history of antibiotic use, this piece deserves attention. It may not give you an overnight fix, but if you ignore it completely, you may miss an important part of why the body keeps producing the same symptom. The two causes that often work together. Now I want to tell you something that many people never hear. Very often, it is not just one of these causes. It is two, and the two that most commonly work together are silent reflux and chronic mild dehydration. Think about what that combination does. Reflux irritates the throat and makes the body produce more protective mucus. Dehydration makes that mucus thicker and harder to clear. So now you have more mucus being made and less ability to move it. That combination is miserable. It is why some people wake up feeling as if their throat is lined with paste. It is why they drink water but still feel as if something is stuck there. It is why the symptom feels heavier in the morning and lingers for hours. The second common pairing is post-nasal drip plus dehydration. Same basic problem. More mucus coming from above, less fluid available to keep it thin and moving. That is why when you improve hydration, some people notice meaningful relief even before they fully solve the deeper cause. Hydration alone may not cure the issue, but it changes the environment the mucus is moving through, and that matters. Important warning signs. Before we go into the action plan, I need to say something very clearly. Most persistent throat mucus is not dangerous. Most of the time it is caused by exactly the kinds of issues we are discussing today: reflux, sinus drainage, irritation, dryness, medication effects, or inflammatory patterns. But there are times when throat symptoms need medical evaluation rather than self-treatment. Please make an appointment promptly if you have any of the following: blood in the mucus, trouble swallowing that is getting worse, unexplained weight loss, a new lump or swelling in the neck, a significant voice change that does not improve, pain when swallowing, or a feeling that food is getting stuck. Those are not symptoms to work around. Those are symptoms to bring to a doctor. What you can start doing tonight. Now let us turn this into action. First, if your symptoms are worse in the morning, stop eating at least 3 full hours before bed. This is one of the most effective first steps for silent reflux. When you lie down too soon after eating, stomach contents are much more likely to move upward during the night. Giving your body that upright time matters. Second, slightly elevate the head of your bed, not a pile of pillows under your head. That usually just bends the neck. What helps more is a gentle incline using a wedge or raising the head of the bed itself a little. That uses gravity to your advantage. Third, tonight before bed, drink a full glass of warm water. And tomorrow morning, before coffee, before tea, before breakfast, drink 1 or 2 glasses of plain water. Not because it is magical, because overnight dehydration concentrates mucus, and early rehydration helps loosen what has built up. Fourth, if post-nasal drip sounds familiar, consider a saline nasal rinse once daily. Use it consistently, not randomly. A lot of people try it once or twice and decide it did not work. But this is about reducing inflammation and helping the natural clearance system over time. Warm saline used correctly can be genuinely helpful. Fifth, review your medications. Write down when your throat symptoms began. Write down any medications you started or changed in the months before that. Bring the list to your doctor or pharmacist. Ask directly whether any of them can irritate the throat or contribute to cough or mucus sensations. Sixth, improve hydration in a deliberate way. Keep water visible. Keep it nearby. Sip throughout the day instead of trying to catch up at once. Use soups, herbal teas, and water-rich foods if plain water becomes boring. The goal is not perfection. The goal is consistency. Seventh, begin supporting the gut gently. You do not need to do anything extreme. Start simple. A serving of plain yogurt with live cultures, kefir, a little sauerkraut, more fiber from vegetables, beans, oats, berries, nuts, and seeds if those are well tolerated. The point is not to chase trends. The point is to give the gut better raw material so the whole inflammatory environment of the body becomes less reactive over time. A quick word about common home remedies. I know many people watching this have already tried every home remedy they have heard of. So let me touch on a few. Honey can soothe the throat temporarily. That is real. If your throat feels irritated, honey may help calm it, but it does not solve the underlying cause. Dairy does not automatically create mucus in everyone. That idea is often overstated, but some people do notice that dairy makes existing mucus feel thicker. So if you strongly suspect that, a short trial reduction may be reasonable. Apple cider vinegar is popular online, but if silent reflux is part of your problem, adding more acid can backfire and make irritation worse. So please be careful with advice that sounds simple but ignores the actual biology. And constant throat clearing itself can become part of the cycle. The more you do it, the more you irritate the tissues. The more irritated the tissues become, the more you feel the urge to clear again. So when possible, try replacing some of that clearing with a sip of water or a gentle swallow instead. What I want you to remember. If you remember nothing else from this video, remember this. Persistent throat mucus is a signal, not a mystery, not a personal failure, not just getting older, a signal. And the most common messages behind that signal are these: silent reflux, post-nasal drip, medication irritation, mild dehydration, and inflammation linked to gut imbalance. For many people, it is not one cause alone. It is a stack, a combination, a few small things happening at the same time until your throat becomes the place where your body finally gets your attention. And that is why lozenges alone do not solve it. That is why carrying water everywhere may help but not fix it. That is why throat clearing becomes a habit instead of a solution. Because the body is asking for understanding, not just temporary relief. Once you understand that, you stop fighting the symptom blindly. You start looking at patterns. Morning versus all day. After meals versus random. After lying down. After medication changes. During dry weather. When dehydrated. When digestion is off. That is how you begin listening properly. And once you listen properly, you can respond much more effectively. You deserve that clarity. You deserve more than being told to just live with it. And you deserve to know that a symptom this common can have very specific explanations. If this video helped you, let me know in the comments which of these 5 causes surprised you the most. Was it silent reflux, post-nasal drip, medication side effects, hydration, or the gut connection? And tell me how long you have been dealing with this. Weeks? Months? Years? I read the comments, and your experience genuinely helps shape what I cover next. If you know someone who is constantly clearing their throat, carrying water everywhere, or waking up every morning with that same heavy coating in the back of the throat, please share this video with them. Sometimes one explanation can change the way a person understands their body after years of frustration. And if you have not subscribed yet, make sure you do that now and turn on notifications. Because I have another video coming soon on the deeper connection between gut health, chronic inflammation, and some of the most common symptoms adults over 55 struggle with every single day. You do not want to miss that one. Thank you for being here. Thank you for taking your health seriously. And most of all, thank you for paying attention to what your body has been trying to tell you. Because once you understand the message, you can finally start responding in the right way.